Hello everyone, I'm meteorologist Adam Joseph, and I am completely thrilled and honored to host today's town hall, LGBTQ Health and Wellness, presented by Mainline Health. This is really an important topic, especially considering the disparities the LGBTQ community faces when it comes to care. As a proud member of the LGBTQ community myself, I've struggled with mental and physical wellness, but I have not taken for granted the inclusive care that is now offered. During the town hall, we'll chat with experts from Mainline Health to get their perspectives and helpful resources and learn about their experiences working with LGBTQ patients and their families. The lesbian, gay, bisexual, transgender, and queer questioning community, commonly known as LGBTQ, faces discrimination on a daily basis, which includes disparities when it comes to health care. These disparities are seen in many areas, including behavioral health and physical health. Discrimination against LGBTQ persons has been associated with high rates of psychiatric disorders, substance abuse, and suicide. Overall, LGBTQ individuals have less access to health care and subsequently have worse health outcomes. Mainline Health is committed to the LGBTQ community by providing a safe and inclusive environment where patients, families, and visitors can expect quality care.
I can't think of anything worse than to be afraid of seeking health care. LGBTQ inclusive care at Mainline Health is an initiative we put together a number of years ago to ensure that members of the LGBTQ community felt welcome, that they feel the respect that all of us deserve.
At the Gender Inclusive Clinic at Mainline Health, my son trusts the providers. If you're trying to encourage a teen who may be reluctant to disclose feelings or behaviors, I would really urge parents to not delay. Find a gender inclusive clinic. We really have found at Mainline Health so much acceptance and also interest in learning. They're always ready to learn something new and read more about it, listen to somebody's experience, and then apply it to the next situation, I think is what sets them apart.
This culture of inclusive care is fostered by requiring physicians and staff members to complete LGBTQ training and education at all locations and having in place strict non-discriminatory policies. What it comes down to is that all individuals want to feel included and cared for when it comes to their well-being, not just in medical or professional settings, but at home too.
As a dad, one of the things that we really pay attention to is the mental health of our child. You know, kids who are trans or otherwise, they need a lot of support and they need a lot of help in navigating the world. It's not always very warm and welcoming to them. And we know that statistically, kids who are trans or queer who don't have parental support are at much greater risk for suicide, for drug use. And so the more we can advocate for them, both with doctors and counselors, the overall better health they're going to have. It's really hard for some folks to go get medical care in a timely manner when they need it. And especially from this community, there's a lot of fear because there has been so much rejection, so much misunderstanding.
Having LGBTQ inclusive practices, what I think we're signaling to our patient population is, you can trust us. You can trust our care providers. Your LGBTQ status is important for us to know and will be respected by us and recognized that's part of you.
A huge thank you to Liam and Diana for coming forward, sharing their experiences. Really being open, being honest can definitely be life-saving for similar families going through the same experiences. And it's great to hear from Jack how essential LGBTQ care is to the Mainline Health's mission as an inclusive healthcare provider. Okay, let's get this conversation started. I'm not here alone. You can see beside me here, we got 3 guests. It's my pleasure to introduce some of our experts from Mainline Health who will provide more insight on many of the topics we're going to talk about this evening. First, right next to me, we have Dane Menken. He is the Division Director of LGBTQ Inclusive Care at Mainline Health. In the middle, we have Jessica Malavi. She is a clinical manager of addiction specialty programs at Miramont Treatment Center, Mainline Health. And finally, we welcome Brian Bodie. Brian, he is a family and sports medical physician at Mainline Health. So to all of you, I want to welcome you. Thank you for taking your time here with us today. This is going to be a very important and enlightening and educational conversation with our viewers. And I want to first talk about with all three of you. This is a question for all three. I'm going to start with Dane first about the importance of seeking LGBTQ inclusive care. I know a lot of the patients, I'm sure, are fragile, broken, kind of at a crossroads. So why does LGBTQ inclusive care really matter when it comes to an individual's physical and emotional wellness?
Well, thanks for having us. The question seems like it should have a simple answer, but it doesn't. We all are pretty vulnerable when we enter into any healthcare system. We're often not feeling well. We're often frightened by what we're experiencing. Sometimes we're in pain, or we're just scared because we don't understand exactly what's happening. So if you take that level of vulnerability and add a layer of maybe having not been treated well in the past, or maybe add a layer of not having good family support or having good social support, or maybe having a mental health condition that's never been appropriately addressed, you can see why somebody would really struggle if they are LGBTQ and engaging in the healthcare system with those additional layers of worry.
Yeah, and Dane, I also want to bring in Jessica, because Jessica, you may be able to enlighten us a little more also kind of on the emotional aspects of it and what you do and when you see these patients.
Yeah, so all the rates down from substance use disorder to mental health to suicide are much higher in the LGBTQ community. It's about 30% in that community as compared to 9% in the general population. So I think, barriers to healthcare, there are experiences where not everybody is maybe on a level where there's full cultural competency or sensitivity for the LGBTQ community. And if you're somebody from that community that's gone for treatment or had a negative experience before, you may be hesitant to go back. I think there's a general vulnerability, like Dane mentioned, where are my needs going to get met? Am I going to be safe? Am I able to be who I really am? Or is this something that I have to hide? And that's all a reenactment emotionally of what they go through on a daily basis. I think the level of shame that happens from having to live a certain way that doesn't match how you feel is a very difficult thing to experience internally for anybody. And then the idea of being rejected or abandoned, even by your own family or people you're in close relationship with, is an excessive stressor to have to manage for somebody in this community.
Very well put there. And Dr. Abadi, as a doctor, what is your insight on this particular subject?
Yeah, the LGBTQ health really matters because their health outcomes matter. It's been shown time and again that LGBTQ individuals have poorer health outcomes than people not in that community. There are higher rates of chronic conditions when people get older. There are higher rates of certain types of cancers. And so LGBTQ health matters because it matters to bring their health to be more equitable with the general health of the population.
And I want to keep this going with you, Dr. Body. I'm, just to disclose, I'm a patient of Mainline Health, have been for almost 16, 17 years here in Philadelphia now. Always had, a great talk with the doctors that I've been with, that I've been very open with them as well. So for you, Dr. Body, how would a regular checkup be different for someone like myself or someone else in the LGBTQ individual? Is it that different, or is it relatively the same, do you think?
Yeah, that's a great question. And, while I haven't been a doctor for 17 or 18 years, the visit for an LGBTQ person is super different because they have different health needs. By letting your provider know that you're LGBTQ, your provider can then sort of tailor that visit to more match your specific needs and values. For example, if birth control isn't something that's relevant to you, then your provider won't talk about it with you. And the same thing goes with cancer screening for specific types of cancers.
And Dane, I want to bring you in also with that question as well. How would it be different? Is it different, for those in our community?
Yeah, I think it really is different. I think that people often are in a medical visit focused on one particular problem, and once that particular problem is addressed, there's time to go ahead and talk about things like screening and prevention. And those things often get pushed to the side when a provider is not comfortable or not exactly sure what body parts they're talking about, or if the provider is not comfortable with the language to describe those body parts that are relevant, or they're not comfortable with the language to describe the partners that are involved in the relationship. And I think LGBTQ care kind of embraces all of those differences in people, when people are not necessarily sure as the patient that they're comfortable bringing those things up.
Yeah, and you just had mentioned about, the prevention screening and the treatments. They're important for LGBTQ individuals. Is this sort of treatment changed over time? Have you seen, people more comfortable? Have you've seen different questions? What are you seeing, when you speak to individuals? Has it changed recently or not?
I don't know if I would say recently. I think it's more of a slow kind of cultural shift that I've seen over maybe the last 5 to 8 years. And what I'm seeing is people that are more comfortable recognizing that, their shell may not indicate it, but, the body that they're in, but they have a cervix and they are concerned about cervical cancer. Or, they're not necessarily sure that they've been comfortable up to now talking about whether or not they've been exposed to, HPV, and should they be screened for HPV. And there's a lot of specific kinds of screenings that um, the physician or the clinician may know about that the patient doesn't. But I've definitely seen a shift in LGBTQ people feeling more comfortable and more empowered and better educated to say, no, actually, I know you think this about me, or maybe you're not sure that this is true for my body, but I am concerned about pregnancy. And you wouldn't know that by looking at me. But can we talk about contraceptives, even though in your eyes, and you're reading me as male?
And Dane, I'm going to stick with you for a second here too. Mainline Health, offers specifically, always a word that I've had trouble since I was a kid, specifically, at their branches. What do they offer specifically, and the hospitals when it comes to inclusive care?
Yeah, some of the specifics that we've worked hard to put into place are things that you would think would be simple, or readily available. Things like on-site point of care or rapid HIV testing, or on-site sexually transmitted infection treatment, or on-site, resources for mental health. Things like on-site or accessible sites for more information. When you get somebody who is early on in a coming out stage of their life and they are seeking more information in many traditional practices, that information may be very generic in nature. But when you're at a site that sort of puts this at the forefront, there's a paper or a pamphlet that you're handed, or an actual site or place that somebody speaks to you about where you could find the information you're looking for.
And I think that's really important when you said, kind of like sight. This conversation is one thing, but to be able to see a poster on the wall, it makes you feel comfortable when you step in and you see something that relates to you. And I'm going to switch topics just a little bit. Jessica, we're going to talk about, addiction in the LGBTQ community. It's really an issue. And members of the LGBTQ community, when they are struggling, they try to find different outlets, and a lot of them are likely to turn to drugs and alcohol. Do you have any sort of reason why that is the case?
Yes, I think that people of the LGBTQ community suffer a lot more emotional trauma and distress than somebody who may identify as heterosexual. They go through repeated experiences of discrimination and stigmatization. Things can progress even as far as hate crimes and physical and emotional abuse. So these traumatic events are impacting people in a way that they're not always effectively processing them. And they get stuck and they impair how we build relationships, how we cope with our emotions, how we tolerate discomfort. So oftentimes they need something that's going to help them to numb out or escape or gain some sense of relief. And substances are a primary go-to because they create instant gratification. And then also dealing with some experiences around internal homophobia. People don't really recognize that much, but in the community, because of their experiences so much externally with how people associate sexuality as being a negative thing, they start to kind of internalize that and have a hard time accepting themselves with the way in which they identify. So I think that with all of this kind of collective experience, both externally, internally, within their family dynamics, within their relationship, and within their own core traumatic experiences, they're at much higher risk to want to go to a place where they can just totally detach from everything that they've gone through and are currently going through.
I completely can understand that firsthand myself. And, Jessica, why do some in the LGBTQ community, hesitate to get help? I know they're trying to pretend to be somebody else, and I think they're a little shy of talking to someone that they don't know about their issues. But why are some so hesitant?
I think it's natural for people of the community to question whether or not they're going to be accepted wholeheartedly for who they are. So, in order for help to be successful, you have to feel safe. You have to feel welcome. There has to be a level of kindness. People are already showing up at their most vulnerable state. So, on top of that, when you're having an experience of who do I need to present myself to be when I walk in here, it can create some additional barriers and resistance. I mean, I think unfortunately, historically, most people could have had some very negative experiences in their attempts and efforts to get help. And that could sort of create additional fears around, is this going to happen to me again? I think also with substance use disorder and behavioral health, like oftentimes if you're going into an inpatient setting, you're in a community experience. It's not individualized. So you're going to be with a lot of peers from different backgrounds, different experiences, different cultures. And so the acceptance isn't always geared towards the staff and the environment. Sometimes it's peer related. And I think the idea of, treatment being meant to be a safe space, it creates fear of, am I going to get what I need in this environment, or am I going to have to reenact what I've always had to do around hiding that part of who I am? Because they know they can't really successfully get help and process trauma and get in recovery from substance use disorder unless they can be completely honest and comfortable in their own skin around other people.
And Jessica, as you're talking, like my cheeks are turning a little red, and I'm starting to reminisce of what I went through. And if Dane and Jessica and Dr. Body don't mind, stick with us for a second. I just would love to share some personal thoughts on my own life, my own struggles, how I am proudly standing here with you all right now, hosting an LGBTQ town hall, something honestly I would have never imagined or expected I would be doing in my younger years, heck, even 7 years ago. Most of you know I'm an open book. I'm honest, I'm real, I'm confident in who I am. I'm a family man, I'm a proud husband. From the outside, most see a happy family, 2 dads, 2 beautiful children. We see joy in all we do, those Christmas mornings and the packages being thrown everywhere, birthday parties, days at the pool, apple picking. We live our lives like any other family would. What you don't see from my pictures, my stories, is the struggles I've battled in order to find that peace and that true love. My younger years, they were hard. They were toxic at times, I tell you. No role model was there for me to look up to that was like the person I felt inside. I was gay, I couldn't accept it. It wasn't talked about in society. I was bullied. I was called names, one being bubbles, word that I really have not ever said until this moment. A word even to this day that scars me when my kids ask for them to play with. I prayed for years to wake up straight, never to be answered. Anxiety attacks, high blood pressure, it all surfaced. The sweet face of the teenager in pain, hiding behind the smile, standing next to a woman. Suicide, of course, like many, crossed my mind. I even tried to drive my Firebird into a telephone pole one day off to a friend's house, only to chicken out at the final second. Television, that added to the pressure, the shame I was hiding. What would the public think if they knew who I really was? Would I lose my job? This is always what I wanted to do. Weather made me happy. I became three people. The Adam a few knew. The Adam I wanted my family and friends to accept, which was the straight one. And the Adam the viewers trusted. At 30 years old, when I was here in Philadelphia, no one knew this, but I cracked, crying at the drop of the hat, on the verge of a mental breakdown. I had the choice to make: take drugs to help my mental status, which I'd never done before, check into an institution for some help, or accept who I was, not only to worry about what others thought. I needed to get that out of my head, and I chose acceptance. I did it in steps. First, to come out to my friends and my family at 30 years old. I'm 40, almost 4 now, so it wasn't too long ago. 7 years later, I came out to the viewers, to the world, with the birth of our son. We have our struggles in life like everyone else, and what I learned is have faith in others, trust others, fight your weaknesses, and accept who you are. And I'm going to leave my thoughts with this, something I came up with. Each journey has a story. Each story has a path. Each path was carved by someone. Be that someone. Thanks for listening to me there, and I want to bring in our panelists again to chat a little bit more. I see smiles, so thank you for letting me indulge a little bit about my personal life as well. And this question's to all of you about addiction in the LGBTQ community. I never went into addiction. I never went into drugs. I come from a family of alcoholism and drugs and issues, and I was thankfully smart enough and was brought up enough to realize not to go into that route. So what are some signs people should look for to help them recognize it's time for help? I know it can be very difficult to see when someone is struggling, but are there any signs? And I would love to start with Dane with this one.
Thank you for sharing your story. That was very, very brave of you. I think the first thing that we see, or that I tend to be aware of, is when you start to see somebody isolate. And when I'm in a routine visit with them, especially the young folks that I see, the adolescents and the college age people, when they're, at that time in their life when you're supposed to be the most social and starting to date and starting to, think about who you want to be when you grow up or where you're going to college. And often in the young teenagers that I see, especially the young transgender teenagers that I see, they don't show that same perspective, that they don't have that same look at the future. And that's one of the first signs that I see as somebody who's struggling.
You work with many of these individuals. Do you see something before someone else does, or is it sometimes hard for you as well?
I think it depends on how fast or how resourced somebody is to have a parent or a guardian that gets them connected. Kids can only do so much. If you're 13 years old, you don't drive yourself to appointments or call and make appointments. So if they're resourced and they have the space and, the people taking care of them to recognize that there's something going on, often, we will see them. But then there's a lot of kids, a lot of youth, a lot of adolescents that don't have that privilege, and they don't have the ability to exercise that. We kind of live in a little bit of a bubble in the region of the country that we live in. And I think the access to resources out here for LGBTQ youth specifically are much greater than they are in other parts of the country. But when I, consult or talk to my colleagues around the country, they're battling things, like 14 and 15 and 16-year-olds who are calling their practices and trying to schedule or wanting to see a therapist or a clinician there to talk about prescribing hormones or talk about prescribing blockers, and they can't see that child yet. And it's a real struggle. The best they could do is share resources with them, like support groups and social groups, or maybe a gay straight alliance type group in a school that they're in, which are helpful things. But it is difficult. It's challenging to see that child kind of in a waiting pattern to get what maybe they've already identified they need.
And Jessica, what can an LGBTQ individual expect to find in an inclusive group setting like the Miramont Treatment Center?
So first, Adam, I also just want to thank you for sharing your story and being
Thanks.
so courageous. I just think that that's incredibly powerful for everyone to get an opportunity to see people in their own strength, go from a place where they had complete despair and inability to really see themselves in a place of success and happiness and love and relationships, to get to that place in their life today. I think that's very helpful for everyone in the community. So thank
Thanks.
you for that.
Thank you.
Um, for Miramont Inclusive Care wise, we try really hard to make our environment friendly. So we will put the rainbow flag up everywhere in every different department so that as people are entering treatment, anywhere from the waiting room to the admissions process to the nursing unit, they have some sort of visual aid to know there's an ally here, right? So they can maybe take a deep breath and relax a little. We also ensure that our staff is properly trained. I think it was mentioned before to ask for preferred pronouns and really get a sense of sexual identity, gender identity, even things down to, things that are policy driven, like room assignments, really looking at is the gender you identify as the same as what you're dealing with in genitalia wise, and how does that impact which room assignment you get? We really want to consider the person to be an individual and allow them to feel as comfortable as possible and as safe as possible. That's the priority. We also recognize that because of all the things that we're discussing right now, the LBGT community is a carve out culture. It's a different culture, and they go through different traumatic experiences that other people can't possibly understand, right? We can empathize, we can sympathize, but unless you've gone through it yourself, you're never really going to know what those experiences were like. And you may be very confident and comfortable in your sexual identity, but still have hesitation to talk about specific traumatic events in front of other people who don't identify. So we try to offer some carve out support groups with a therapist that's equipped to really help them process the level of traumatic events that they've been through, help work through any internal homophobia, help connect relationship wise with other people in the community within Miramont's community so that they have the continued support needed to really work towards a process of recovery.
It's so great what you're doing over there. And Brian, I mentioned how, I'm in the Mainline health system and I have a doctor there. Why is it important, Dr. Bodie, for your healthcare provider to know your sexual orientation or gender identity? Some who maybe can be like, well, I don't want to tell my doctor, but why is it important?
Yeah, Adam, I also want to hop on and really thank you for sharing your experience. And I think it actually really speaks to that question that you just asked me. It is so important to share your sexual orientation or gender identity with your doctor because we can be that first line, that first entry to help you cope with your life, to get you to the right resources that you may need to find, and to help address any mental health issues that may arise from that.